Terrific! We are live here with the first official Vitality Code Live. I started this on Kathy Basil to help get out the information that I know that people are needing to live their healthiest, happiest life. I'm really thrilled to be kicking this off, the very first one, with someone who's near and dear to my heart. It's Dr. Bill Bergman, and he's the one who got me on this path for holistic health 8 years ago when I heard him speak. It was kind of interesting because he was talking about breast cancer at this particular talk. And when I went, he actually spoke more about prevention and cellular health than anything else. And that's what really got me on this track. And without further ado, this format is just 7 minutes and 7 tips. So I'm going to hand it over to you, Dr. Bergman. What is it that people need to know? We're going to be talking about the real cause of chronic conditions.
Okay, well, first of all, let me thank you, Kathy, for your providing the vehicle and the opportunity for your viewers and listeners to be able to learn about really the fundamental causes of chronic disease. You know, we have one of the most advanced medical systems in the world, and when it comes to emergency treatment, our technology is like just at the top of what's available throughout the world. But unfortunately, we have epidemics of chronic disease. And I think that the major gap is because the methods of diagnosis and treatment when it comes to an emergency is just inadequate and insufficient when it comes to dealing with the prevention and the resolution of chronic illness. And so we need a whole different approach. We can't just treat the body as a complex biological machine that breaks, which makes perfect sense in an emergency, like an organ failure of the heart or the kidneys, when, yes, you want to think of the body as a biological machine that breaks, but when it comes to why we have chronic illness and why we have these conditions that develop over a period of years, long before they become, you know, for example, a 911 call in the middle of the night, well, we need a whole different mindset. And fortunately, the research coming out of the major university medical centers is really clarifying the underlying cause of chronic disease. And it really is proving what many of us kind of knew, you know, just based on kind of common sense, that a lot of it had to do with lifestyle factors, with environmental toxins, the choices we make around what we're going to eat, whether or not we're going to exercise, how we're going to think, our emotional life. All of these things really are what are the factors that largely control the risk of chronic disease and the severity of chronic disease. You know, when I went to medical school at Columbia University, the College of Physicians and Surgeons, they taught us that most chronic disease was basically on a genetic basis. And there is a genetic factor, of course. We could say maybe 10 or 20% of the equation is due to our genetic inheritance. But that means that 80 to 90% is beyond genetics, what is referred to as epigenetics. And this is all those factors that fortunately are largely within our control that will affect the health of the body, particularly the health of the 10 trillion cells that make up the body. And what the science is telling us is that the cause of chronic disease almost in every case, I mean, there are exceptions, but almost entirely is the result of these epigenetic factors, things like our diet and environmental toxins and stress, and how these epigenetic factors are affecting our genetic inheritance, what we call genetic expression, meaning the turning on and off of the genes. And so what the science is saying is that these epigenetic factors are creating irritation and inflammation, not acute inflammation like you'd have with a sprained ankle or a bruised elbow, but a low-grade chronic inflammation, irritation at the cellular level. And now the latest science over the last 5 years is focused on the gut, on the gastrointestinal system, because the gut is where we absorb our nutrients. 70% of the immune system surrounds the gastrointestinal tract, and that immune system, what's called gut-associated lymphoid tissue, is there to protect us so that things don't enter the body that through the intestinal lining that shouldn't be there, that only nutrients pass through. But with
Right.
all
So
of
you're
these
the first one that I heard. Sorry, you're the first one that I ever heard about inflammation from. That's like 8 years ago. So this is like your fast forward of getting more specific, that it's really beginning in the gut. So those lymphatic things is that what's trying to safeguard our gut from the toxins? Is that what you're saying?
Yes. In other words, the gut-associated lymphoid tissue, the immune system surrounding the gut, is there to protect. But because of these toxins and food toxins and stress and bacteria and viruses and all, and the overuse of over-the-counter medications, non-steroidal anti-inflammatory drugs, people taking acid blockers, all this stuff that people think because they don't need a doctor's prescription, it's somehow safe to take. I mean, they don't read the warnings, but now the science is saying that these acid blockers, for example, they lead to increased risk of chronic kidney disease, that they increase the risk of gastrointestinal infection. So there's a downside risk to all of these medications that we're taking unnecessarily. I mean, sometimes we need them, but a lot of times they're unnecessary. It's irritating the gastrointestinal tract, disturbing the immune system surrounding the gut, and creating what we call a leaky gut. This means an increased permeability of the lining of the gut to things that normally would be kept out of the bloodstream and kept out of the body generally. That's why this leaky gut is now considered to be the underlying cause of virtually all autoimmune disease. Autoimmune disease means the 70 or so disorders that occur when the body begins to produce what normally would be protective antibodies to its own. So we have 80 different varieties of autoimmune disease. And now we can see from the research that it's connected to the disturbance of the immune system in the gut lining as a result of this low-grade inflammation of the gastrointestinal lining. And from there, it spreads to the heart, spreads to the brain, spreads to the joints. Really, it's behind virtually all chronic disease. Now, the good news is we have ways of testing for leaky gut. Just in the last couple of years, we now have antibody tests that can determine whether or not we have a leaky gut. So we're able to define, is it present in a given individual, to what extent it may be there, and we can also retest after a number of months of putting people on a healing program to make sure that in fact the situation is reversing and that people, their gut is improving in terms of health, that the leaky gut is being healed. So it's very exciting time
exciting.
for us.
Yeah, like you said, the testing getting all the more advanced. So let's go through your 7 tips, and we'll come back and we'll give everybody the information on how they can get in touch with you. This is Dr. Bill Bergman, MD. Awesome. So how about your 7 tips, Dr. Bergman? What would you say?
Okay, so I have 7 points in terms of, basically it begins with eating real food and also trying as much as possible to be gluten-free and certainly non-GMO. I mean, this glyphosate, which is that insecticide, pesticide, this is very, very damaging to the gastrointestinal lining. So we talk about regular exercise. We talk about clean water, being well hydrated with clean, purified water, being in harmony with the natural rhythms, early to bed, early to rise. I mean, that makes sense from a biological point of view. Prayer and meditation, in other words, not just to manage stress, but really to relieve stress at the deepest level. And then the importance of the proper testing in order to get the most effective, personalized protocols for your particular situation. And then following up with wellness coaching, participating in a wellness community where people can support one another, these are the points that I think will go a long way towards helping us to achieve the optimum health that we deserve and the optimum health that we're looking for ourselves and our families.
Yeah. And that's huge. You know, all these tips, they're very simple, but as you said, they tie back to 90% of the conditions out there. So on the one hand, the disease, there's so much we can do within our power to reverse, right, and prevent these conditions. Awesome.
Right. I always say the sooner the better, but it's never too late. But, you know, we want to try to get things before they become too advanced.
And it's exciting, as you said. I'm going to put your website up here. And you said that there are some advanced testings. Dr. Bergman and myself both do consultations. In addition, he's got, I guess it's actually Dr. Bergman MD. Bill Bergman MD would be the website. Oh, is it?
Bergman.com.
Okay, let's try that. So that's great. And somebody could go to that site.
There it is.
He used to be in Denver. We lost him to Naples, Florida. We miss him, and he's available wherever you are, right? You can do these testings from wherever these days, right?
Well, people should get in touch with me through my phone number or email, and then I can discuss their individual situation with them.
Okay, terrific, terrific. Thank you so much for being the first honorary guest here on the Vitality Code Live. So appreciate you, Dr. Bergman, and all the great work you do in the world.
Well, I appreciate your commitment to the health of the folks and the health of the community, Kathy. You're an inspiration. Thank you so much for doing all of this for everyone.
Okay, well, thank you. Bye-bye.
Bye.
Bye-bye.
Good health and happiness.